Sorry, I'm a little lost for words because neither of us have the program in front of us. So we'll find out what the session is in a minute.
I don't have the title of the session.
Thank you so much. Dr. McCulley, thank you. It's a mixed session, that's right.
It's Sunday.
So we're going to talk today about presbyopia and myopic corrections. Excellent. Okay, first speaker's not here? No? Just to check one more time. Very good. Professor McCulley, thank you very much. Take the floor.
Dr. Awad has not made it from Beirut just yet, so I will present our findings comparing 3 different laser platforms. I'll be giving you data comparing the VisX Custom View with iris registration compared to the LADAR Custom Cornea 6000 and compared to the WaveLight Allegretto Custom Optimized platforms. Demographics were similar for the groups with a little bit less spherical correction with the WaveLight group. Now, all 3 platforms are good platforms. So what I'm going to try to do is point out where there are interesting or surprising differences. And with the WaveLight Custom Optimized, we had better 20/20 at 1 week. So early recovery was the best with the WaveLight Custom Optimized. All of the flaps were created with an interlace with a flap thickness of approximately 110 to 115 microns. However, by 3 months, the LADAR had caught up to the WaveLight, and remarkably, VisX lagged behind in quantity of visual acuity. When we looked at pre-op best spectacle, all groups had 20/20, and at 3 months, all had in the WaveLight Custom Optimized and the LADAR 6000 were 20/20 post-op uncorrected. However, we still had this lag with the VisX. Now, why would that be? Well, when we look at our results relative to predictability, we find that the LADAR and the WaveLight are very predictable. However, the VisX Custom View with IR still has a tendency, as previous platforms in our hands have had, to undercorrect. When we look at stability, we find that the VisX was stable but tended to undercorrect just a bit in comparison to the LADAR, which was very stable, and also in comparison to the WaveLight, which also was very stable. Now, here's a remarkable finding. We had a significant number of eyes gain 1 line with the LADAR 6000. Maybe not surprising. However, we had more eyes with the LADAR 6000 lose 1 line of best spectacle correction in comparison to our previous results with the 4000, and this is a bit more than we had been accustomed to, but also this degree of gaining a line was unusual. So when the LADAR 6000 performed well, it performed very well. Contrast sensitivity with the LADAR, pre-op versus post, so an increase in contrast sensitivity. Also with the VisX pre-op versus post, improvement in contrast sensitivity. However, with the WaveLight, no improvement in contrast sensitivity with the custom optimized. Now, all 3 of the lasers had pre to post increase in total higher order aberrations. The VisX had a significant increase in spherical aberration, whereas the other 2 platforms had a decrease in spherical aberration. However, when we come to coma, the VisX had decrease in coma in contrast to the other 2 platforms that had an increase. With trefoil, an increase with the LADAR and with the VisX, but a decrease, oddly, with the custom optimized. Well, in our hands, there was an increase in total higher order aberrations with all 3 platforms. Quantitative acuity with the custom cornea LADAR 6000 and the Allegretto WaveLight Custom Optimized was better. We had better uncorrected visual acuity, and we had better predictability with those 2 platforms compared to the VisX. And what we found with the VisX, even with the IR, is that it still has a tendency to undercorrect. VisX, and to a little bit lesser extent LADAR, had improvements in contrast sensitivity in comparison to the custom optimized with the Wavelight, which did not. So in our hands, all three platforms really have performed quite well. They're all three good platforms. If that's what you have, you should continue to be proud of what you have. However, our best results to date, quite honestly, have been with the LADAR 4000 rather than the 6000. And our hope is that we will have even better improvement in our results with the Wavelight Allegretto true custom treatment, as we had significant improvements in some areas with the custom optimized, but not in all.